The next important topic is the prosthetic heart valves. So we'll go through in detail. First, the type of the prosthetic heart valves, mechanical and biological, and three types of mechanical valve and 4 types of biological valves, either transcatheter or surgical biological valves. Then what is the mode of treatment or follow-up for prevention of thrombotic complications and management of bleeding while patient is on anticoagulation. And next is the follow-up of the echo for prosthetic valve function and probable complications, possible complications like degeneration of the prosthetic valve, thrombosis with or without embolism, pannus, paravalvular leak, and patient prosthesis mismatch. So we'll see one by one in very short overview. So prosthetic heart valves divided into 2, metallic heart valves and biological valves. So these are the actually 3 types of metallic valves. This valve is called a Starr-Edwards valve or a ball and cage valve. So there is a ball with a cage. This is inspired by a bottle stopcock model of valve prosthesis designed by Dr. Starr, young surgeon, and Edwards, who is an engineer. Even now there are many prosthetic valves which are named after the engineer Edwards by Baxter company. So this is the initially when patient underwent metallic valve, they were surviving only for maximum 3 months. So ball and cage valve is the only valve which made patients survive more than 2 years. This is a primary model, first model of a successful metallic valve. So it is more suitable for a mitral valve, also for aortic valve. So it was initially tested for a mitral valve position. The risk of thrombosis is more with a ball and cage. You can see this is the stent frame, that is a support frame which is lodged at the annulus. And there will be a ring here called the sewing ring, so which is sutured to the annulus. And here this is the cage in which the ball is lodged. So when the ball comes to the position rest, it is closed. While it comes to the cage, end of the cage, it is open. So there is a lot of metal here. So there is a increased thrombogenicity of this valve. So these are usually now replaced by other valves which are either single tilting disc or bi-leaflet valves. There are 2 types of the 2 models of single leaflet. You can see these are the hinges and a single leaflet. It opens and closes like a CD here. So this also the other structure is the same. You can see this is the stent frame. And this is the sewing ring which is sutured to the annulus, and this is the hinge to which this tilting disc is attached. So there are multiple newer generation tilting discs, but the commonest one which is used, which needs a special mention, is a bi-leaflet metallic valve. This is a St. Jude valve. You can see there is a stent frame and a sewing ring. Here the bi-leaflet, which is semilunar shape, is attached in an oval hinge. And see, there are 3 openings here. When the valve is open, there is a semicircular opening here, right side, left side, and a rectangular opening here. This leaflet is about 75 to 90% in attachment with the ring. So when this opens, there is full flow across the valve. For example, in a mitral valve. When this closes, there can be 3 regurgitant, physiological regurgitant flow. So 3, one from here, one from here, one from here. 3 flow, which is very physiological. So physiological regurgitant 3 flows from a St. Jude bi-leaflet valve. So this is the commonly used valve now, St. Jude bi-leaflet valve. The other one, apart from the metallic valve, there are biological valves. So the biological valves you can divide in other patterns. One is the transcatheter used valves and surgical used valves. We can divide it into 3 types: stented, stentless, and sutureless. So we can see one by one here. These are the stented. What is the difference between stented and stentless? They have similar, the stent frame or a metal frame to which the valve leaflet is attached. In a biological valve, we can use 3 different types of material: porcine valve tissue or porcine pericardial tissue or bovine pericardial tissue. So the valve tissue is biological, while this is a stent frame and a sewing ring. So these are the different types of stented biological valves. These are the stentless biological valves. You can see there is no stent metal frame supporting. So there is a direct sewing ring which is attached to the annulus. So in this there is a special mention for a porcine freestyle stentless valve. So here there is a aortic valve, valve tissue and the aortic root along with the coronary arteries. See, this is also a Edwards license stentless valve. So this also have three patterns. One is porcine valve tissue, bovine pericardial and bovine porcine pericardial tissue.